are currently embarking together, the lead being USM, together with several key stakeholders, including collaborators from the UK, from the private sector, and also from MOH, using the Newton-Ungku Omar Fund. So the title of this project is a scalable solution for supporting informal stroke caregivers in Malaysia, systematic development and feasibility study. So the aim of this project is to assess the feasibility and the acceptability of a culturally tailored intervention, which includes the training program and a mobile phone application to improve caregiver skill in managing the physical and psychological need of stroke patients and their needs. As you all know, the burden of NCDs continue to increase, and one of the unfortunate complications of people living with hypertension and diabetes is stroke. You know how devastating a stroke can be, particularly for stroke survivors. Once they are over the acute phase of hospitalization, for some of them, it is a long road to recovery, and for some of them, the disability can be permanent, in which case the patient will be at home. And this is where the caregivers have an important role to play in managing them, in improving their quality, or maintaining their quality of life. And the objectives of this project, as it were, we wanted to see whether we can develop a feasible and acceptable culturally tailored intervention, which improve the caregiver skills. And this study itself has several objectives. We want to analyze the context in which the intervention is implemented. This is important. More often, we have people from the lower socio-economic group where services which is made available to them outside of the healthcare facilities for stroke survivors once they are discharged from hospitals can be quite limited, particularly in some geographical regions. So context does matter. We will develop and iteratively refine the prototype of a culturally tailored intervention. We will hopefully evaluate the feasibility and acceptability of the intervention. And lastly, we will see how we can identify a model for the integration of the intervention within the Malaysian healthcare system. So that's the project by itself. So one of the activities that we would like to spin off from this project is to have webinars, and today is such an occasion where we have the pleasure of inviting our partner from the private sector involved with this project actively. And I would like to have I have the pleasure of introducing our speaker for today. All right. So Dr. Raymond, he's a medical practitioner specializing in family medicine and aviation medicine. Having completed his training at IMU, International Medical University, Malaysia, and University of Manchester, UK, started his part of his career at Raffles Medical Group in Singapore, and managed the 24-hour clinic at Changi International Airport, hence the aviation component of his interests. He had co-founded Doc2Us, and it is with Doc2Us that we are collaborating on this current stroke project. And well, I'll just stop there. Perhaps he would like to talk more about the Doc2Us itself, and it gives me great pleasure to pass the floor to my friend, Dr. Raymond. To you, Raymond.
Thank you, Dr. Feisul. Hi, good morning, good afternoon, everyone. And first of all, thanks for having me, to share a little bit on today's topic. And let me share my screen. And Yeah, so like what Dr. Feisul mentioned, actually, we are honored to be, participating in this very meaningful, stroke project, which we think it will definitely benefit a lot in Malaysia, especially the caregivers, right? So how can we actually empower caregivers, using technology or hybrid care system, right? And yep. So without further ado, and so today, what are we going to share today? Just very simple, that I think people might be interested, because we talk about COVID-19, there is a significant adoption of telehealth solution, globally. And due to the fact that you're not allowed to go out, due to the MCO, all this, right? So adoption is skyrocketed, right? And hence, we'll go to it. So hence, I thought it would be, very interesting to talk about, what about the future of, telemedicine and also the digital health, right? So, oops, let me see. Can I change? Okay. Okay. So a little bit myself, I think Dr. Feisul has briefly talked about. So we'll talk a little bit about what we do actually as a telemedicine player in Malaysia. So why did we call doctors? Basically, we wanted to our people, the patient to actually talk to us. So it sounds like talk to us. So how did it start actually, back in 2015, because, I'm sure a lot of healthcare providers here will agree with me that, and often we have family members, relatives and friends, often, come to us and call us up or send us text or during, Hari Raya or festival season, right? They'll come to you, the auntie, uncles, doc, what is this, right? And it just got me thinking, back in 2014, what if those people without such, privilege, right, to get the access to healthcare providers just for informations, for some referral or recommendations. And because of that, naively, we thought, back in 2014, let's create a simple platform so that we can connect both parties, the patients, the consumers, and the healthcare providers of their choice. So that's how we started, and we formed the company in 2015. And of course, one of the contributory factors because of my late dad, who was very sick. So he got very, advanced acute leukemia actually in 2014, and I think he didn't survive, in 3 months. But I think we were very thankful that during the period of time, I think we were guided and referred to the right people, at the right time. So we had lots of information, for him to make, the informed consent and informed judgment and of course decision, right, to go through chemo, all this. So I think we were very much, appreciative of all this, and because of that, it really contributed to us, building something that people actually find it beneficial, value added to their, healthcare journey. So as such, we formed the company in 2015 and providing the telemedicine solutions. Yep. Okay, next. Okay, so in terms of ecosystem, since the launch in 2017, so we have been in the market for more than 4 years. So if you look at telehealth or telemedicine players, actually, you can't really differentiate all of us because the functionality is the same. It's just like you go to Lazada and Shopee, right? So the function is the same. You go and shop and buy and get it delivered, right? So the only difference is actually the branding, the color, the pin color, right? So likewise for telemedicine players, right? Actually, more or less the same, right? So you do a virtual consultation, prescriptions, medication delivery, monitoring, all this, right? So the functionality is almost the same, right? And of course, what actually differentiates all of us is actually our, our commercial model or business model. And of course, the ecosystem that we built, right, in all these players. So for us, actually, this is our ecosystem, and one actually differentiates us from others is actually the e-pharmacy solution. We work very closely with all the pharmacy partners where how can we actually provide, digital health solutions, telemedicine incorporating into their practice, the day-to-day practice, right? Providing the digital prescribing and digital dispensing in a remote manner, and for all the community pharmacy as well as a retail pharmacy. So these are our one of our unique selling points in the market. And of course, in healthcare, we can't do everything online, even though today we talk about digital health, right? Like you're not healthcare, no matter how advanced the technology is, I think there's certain things that we can't do. There are limitations, restrictions, and for instance, the human touch, right? The practice of empathy is very difficult to practice, online sometimes. Of course, it's not impossible. You still can through the video consultation. You still can, portray the empathy part of you, right? However, I think having a physical care is definitely somehow better than the online care in this aspect. But however, in today's and tomorrow world, we can't do everything offline because it's no longer relevant anymore, right? For today and tomorrow's healthcare, and this COVID-19 has proven, right, the need of innovating and advancing to virtual to online. So what we believe in is actually a virtual health, the hybrid care model where online offline work very closely together, like the O2O model that will actually maximize the benefits and values to the patients. So our consumer healthcare arm is actually all our offline services. So we venture the clinic as well as the healthcare centers. And also we did some on-site work like vaccination programs, wellness program, health screening, and home care services. How can we bring care to home rather than every time ask patients to go to clinics or hospitals, right? There are certain scenario we can bring care to home. And this is actually very true, especially for, for instance, the stroke patients, right? And often, the most of the time, they stay at home or rehab center, right? And how can we bring more care to them and in a more proactive way? So that is actually leveraging on the technology that we have, and very, very glad that, the project that we are working with USM and MOH or this, right, will actually, target this space as well, especially empowering the carers. And on top of that, the health and wellness actually is our content. So we churn out a lot of content, every day to really educate and encourage our consumer and patients. And as such, we also, work with some of the pharmaceutical companies to raise awareness of certain diseases so that we can actually, target more patients for early detections or really look into their NCD, management and things like that. Yep. All right, so a little bit of milestone of us, started 2015, and all the way we started with the pharmacy in 2017. And we are not really B2C model, which is business to consumer. We are very much B2B, business to business, right? And of course, we integrated and worked with the labs like Gribbles, and we developed a whole range of e-prescription system, and I work with TP, third-party administrators for for the corporate world. So we also serve the corporate employees as well, and to take care of them in terms of their chronic diseases, the NCDs and all this, right? And of course, 2020 actually was a very bad year for everyone, right? And because of COVID-19. And we rally a group of more than 100 voluntary healthcare providers to really step forward to provide virtual health advisory to the public on COVID-19 related matters 24/7, and that's free of charge, and that's almost and that's actually a voluntary basis, and even until right now. So we are very glad and honored to be partnering with the MOH on the Sejahtera, integrating into the Sejahtera community to provide such services to the Sejahtera population. From the very beginning, we were answering about what is COVID-19 online, right, to the public, and should they wear masks or not, right? Those days we're still talking about it until all the way like is vaccine safe or not, or all the way to COVID-19 patient quarantine at home with the families, very sick. What's next, So it's just quite crazy, right, over the past 2 years. So and we are very glad and honored that we are able to contribute a little bit in terms of fighting this COVID-19. And of course, we actually work with Ministry of Health and the state actually to actually do a lot of or co-organize a lot of PPVs and all this. So in terms of prescription, actually, we have actually improved a lot from the very beginning, and today we have done more than 700,000 electronic prescriptions. Yeah. Okay. So this is a bit of 2021 wrap up, and we've seen more than 1 million patients and consumers in 2021, and we've done more than 350,000 online consultation sections. Our average response time was 38 seconds, and currently our network pharmacy more than 1,000, close to 1,300. So our target is to actually reach up to 2,000 to really digitalize their practice to ensure that the whole digital, the whole prescribing and dispensing is safe and of good quality with the support of the online doctors. So it's no longer pharmacists working silo in the community. Actually, how can they work together with the doctors, right? And really to ensure the drug safety. And this is what we have been working on. Yeah, so and the rest is actually, as you can see, is quite self-explanatory. Yeah. Okay. So COVID-19 now, back to COVID-19, how did actually COVID-19 influence the whole digital health adoption? In fact, if you look at a lot of papers, consulting firms and all this, they've done tremendous studies on this, and in fact the conclusion is it has actually accelerated the whole adoption of digital health worldwide, right? And perhaps, in the past, you might need to take 10 years, for the, healthcare facilities to adopt such solution. And in fact, during COVID-19, less than 12 months, the healthcare facilities or institutions, they are able to actually, adopt fast, and due to the pain, right? Everyone was suffering. So pain actually is an important trigger for change, right? Even though change is painful, however, if you look at this COVID-19, which is unprecedented, and this has proven that actually change is possible in a very fast manner. It's provided whether how we actually plan our resources and how painful the trigger is. For instance, COVID-19 for hospitals, right? It was very bad because initially a patient not going to the private hospitals, right? And true enough that the private hospital venture into digital health, into telemedicine within 4 weeks, where if you go into the HIS system, it will take ages, right, in the past. But you can see even big hospitals, private hospitals, they had become very agile in such a way in adopting a solution to really reach out to patients, to really continue to engage with patients, right? So this is something quite encouraging in Malaysia. So look at the various applications of digital health. I know there are a lot of them. I think it's more than here. So there's some of them we actually able to pin up. So as we have mobile health, right, and talk about mobile technology first, right? So if you compare to 20 years ago, for us, our first device is always, usually a desktop or maybe laptop, right? And then it has evolved to our first device becomes, the tablets, the iPad. Until today, I think the first device, right, actually has become a mobile phone, a mobile smartphone, right, to the young ones. So this is something that we also in healthcare, we also need to evolve to go for mobile first instead of desktop first, right, or portal first, right? So this is something that for us to really think through, that actually mobile technology is very important, and so is the mobile health. And of course, you have the whole, health information technology, talk about precision medicine now, the genetic testing is getting more and more common and more affordable because of the technology, and become more common. If you compare to 30, 40 years ago, it cost a bomb. But now it's actually, it costs less than 100 ringgit. Actually, you can get a saliva test, to do your genetic testing. So this is because the advancement of technology, and this is very encouraging as well. Precision medicine, repetitive analytics. So we talk about big data, right? And when you do digital health, day in, day out, we collect so much of data, right? All these raw data. How can we make full use of this data and make it more insightful so that it benefits the providers, the policymakers, the payer, and the patients as well? The 4Ps in the industry, in the whole ecosystem, right? And mostly, right, to really predict the future. For instance, NCD patient, which can actually, based on the data input, if the algorithm can predict actually in 3 years time your risk of getting cardiovascular disease are very high, so you should do something about it. So all these are very relevant to today's and tomorrow's healthcare practice, right? So of course, the bread and butter, telehealth and telemedicine, you got the robotics, all these automations, and it's wonderful, technology, AI checkups, biotechnology, and all this. So we can see from here, of course, IoT variables, devices for the remote monitoring, and having diagnostic in outside the clinics, outside the lab and the hospital. So imagine you can actually have a diagnostic at home, right? Having the smart home, solutions. So this will be the future, because we want to bring care to home and reduce the load of our government sectors, right? So that they can actually focus more on the cases that they need to focus, where like the complex cases or the procedure-driven cases where you need, a secondary or tertiary care. So really about, optimizing the whole healthcare resources and of course expenditure by leveraging on technology, right? So these are the applications. So now talk about telemedicine. What can it accomplish, right? So I'm sure a lot of you know about the good side of telemedicine. It can actually make it more efficient and more convenient, based on the McKinsey report that they survey all the stakeholders within the healthcare industry. The number one value proposition all the stakeholders are looking for is actually convenience. Of course, followed by data security and safety, all this. But number one value proposition based on all the survey is actually convenience. So if our healthcare service delivery can provide some form of convenience, actually it has done a lot of good things to the to the patients, and also to the providers. and hopefully to the payer and policy makers as well, right? And of course, when you talk about telemedicine, telehealth, definitely have a wider reach, and you can actually reach out to rural areas provided infrastructurally ready. And one of the challenges, in Malaysia or in developing country is actually infrastructure readiness, right? So you might have a very top-notch technology, AI, 5G, but you look at rural areas, they might not have such, infrastructure, right, to support even 4G, right? So how can we actually work around it to actually maybe to adopt, low tech, right? So our ultimate aim is really to help to reach out to people, right, in the healthcare perspective, and to make it, more accessible, safer, cheaper, better, faster, right, swifter, and surer, right? So that would be the aim, and how we reach there, actually it all depends on the context, right? And of course, in this case, the infrastructure, right? And I believe, telemedicine or the technology definitely, plays a very important role in the next, 5 to 10 years time, right? And of course, because of all this, efficiency and convenience and wider reach, right, you can actually bring down the cost, not only to the healthcare, but also to the drugs, right? Which you can see, in the States, there are a lot of initiatives to bring down the drug cost, right? So like it or not, the true cost of the healthcare, apart from the healthcare providers, which is, quite high expenditure on in most countries, right? Followed by, the procedures and also the drugs. If we can bring down the drugs cost, right, actually that can actually bring down a lot, right? And for the name of sustainability, because it'll be very sad to see patients not able to receive treatment due to the cost, right? And for instance, certain chemo, certain cancer drugs, right? And so hence, how can we actually leverage on technology to bring down the cost, the whole supply chain management? How can we actually, make it more efficient and more cost effective, right? And of course, you can actually go borderless access to various, professionals, and of early detection diagnosis, guide and help for caregivers. And this is very important for our project, the telestroke project, right? Where, very often, stroke patients, it's quite tough, but again, it's not only for the patient themselves. The tough part is actually on the carers, the family members, the burden that they, the stress, all this, right? And how can we actually use technology to support them, remotely? And how can we continuously engage with them to provide support, to guide them to take care of this, of their loved ones who actually been having strokes, right? So this is a very important project, and we believe this is going to be a very valuable, very meaningful project that we are working on with all the parties that, Dr. Feisul mentioned just now, including USM and the UK and MOH side. And hopefully this will actually drive, more awareness on actually, when you are taking care of stroke patient, for instance, or cancerous patient, you are not alone, right? Because often, let alone the patient themselves or the family, they don't actually live with the problem when they go to hospital clinics. They live with the problem 24/7. So how can we actually continuously engage with them, support them outside clinic and hospital in a remote manner, right? Of course, we cannot send a healthcare providers at the home, right? Not everyone can afford, right? But how can we actually scale it up using technology? And this is the aim of the project, right? With all the experts inside, and I'm very positive that, it will actually drive the awareness, and also, bring more guidance and education to the people, especially to the caregivers. And of course, telemedicine actually can somehow, provide, some of peace of mind. Yeah. And in terms of growth of the telemedicine during COVID-19, as I mentioned, all in all, 50% year to year due to COVID-19. And you can see all the figures here and the market size. And I'm not going into that. It's 100 billion market size, in Asia Pac, and things like that. So the market is definitely huge. That means the need is huge as well for telemedicine industry, right, or digital health industry. And so a little bit of the adoption, right? So we talk about one of the challenges of digital health is actually adoption, right? And people are always skeptical, and not only from patients but also from the providers, right? One of the commonest questions asked, how can you actually examine patients, remotely through the screen? Actually, we can't, right? Even though with the diagnostic IoT, there's still a lot of limitation. It's really about understanding the limitations, the do's and don'ts. So once you know and understand limitation, actually it can be very safe, right? So and this actually this image actually shows the adoption in Malaysia and in terms of e-prescription. We started in 2017. That whole year, we did less than 500 e-prescriptions, and it was quite upsetting for us, and because we were very ambitious, right? And hence we actually pivoted, in first year to B2B. That we partner with pharmacy, understand their pain points to provide the solutions, and hence we actually that year we did 5.5K, and subsequently we actually started serving a corporate like the banks, the MNCs, right, multinational companies. They need some form of continued engagement to provide to the patients, some form of remote care to the employees. So hence in 2019 we saw close to 90,000 e-prescription. And 2020, because of COVID-19, actually it skyrocketed to more than 160% growth in terms of e-prescription, adoption to 232,000. And last year we did more than 300,000 e-prescriptions. Yeah. So the trend is quite encouraging in terms of adoption. And so a little bit back to the industry, as you can see, the growth is actually quite promising in terms of digital health during the COVID-19. And just to give you a glimpse, right, in China itself during this pandemic outbreak, one of the major players is called Ping An Good Doctor. Their adoption rate has gone up to 900% just during this pandemic outbreak between 2019 and 2020, right? And majority of them actually grew more than few 100%, right? In terms of adoption, it's crazy. In Southeast Asia, you look at in Indonesia, right? So average about 150%. In Singapore, we're talking about more than 100% actually, and in Malaysia, we are looking at roughly about 40 to 70% increased adoption in terms of telemedicine during this pandemic outbreak on average. Yeah. Okay. Right. So what lies in the future about telemedicine and digital health? So based on McKinsey survey recently, is reported that 76% of patients actually, and they are interested in using telehealth services moving forward. And this is quite reassuring. And of course, user experience is also very important, because that will also affect the retention, the drop rate, and all this, right? And 57% are also open to remote monitoring of their existing health condition using an in-home device like the IoT monitoring devices, right? And so this is still quite encouraging if you compare to 10 years ago. Especially in Malaysia, you do not need to use all this, right? Because by and large, accessibility to healthcare is actually not a big issue in Malaysia. Of course, we're not talking about very rural, isolated area. By and large, majority of places in Malaysia, actually, you can access to private or public healthcare services, right? Actually, accessibility is quite good, right? And you throw a stone, you can actually hit the clinic, right, in Malaysia. And however, actually, there's still a lot of pain points to be solved, right? And cost, the quality, the outcome, all this, right? So these are things that the technology can help to complement, to support, and to improve the current healthcare service delivery, right? So one of the good examples of the adoption in Malaysia is actually Sejahtera. So you look at Sejahtera adoption, it's crazy. Of course, one may argue, oh, I got no choice. This is enforced, right? If I don't download this, I can't go anywhere, right? And of course, you can argue that I can use a paper, to write, but I think they're going to scrap it off, right? So this is a very good example of the digital adoption. The other example is actually in China. We talk about WeChat, right? And where the e-wallet is almost like 100% adoption, right? All the way to farmer, to the rural area, right? Massive adoption, because this is a top-down approach, truly enforced. So likewise, Sejahtera is also another example that adoption of digital health or digital solution can be done if the motive is right, the objective is right, with the partnership and the alignment with all the stakeholders, right? So sometimes it has to be done top down, but also need to work with different stakeholders. For instance, Sejahtera is a collaboration. The collaborative efforts between MOH and the private sector is a PPP approach as well, right? So this is a good classic example that when we gather all the resources, energy, values together, it's going to be mind blowing, right? And because of our integration with the Sejahtera, actually from the beginning until today, we have done more than 2.2 million hours of virtual health advisory session, helping quite a fair bit of people to levy their concern and anxiety about COVID-19 and support them remotely using digital health. Yeah. And so few more slides. So in terms of caregiving, right, and all this while, I think we have been talking about disease-centric care, right, in the past, right. I think more and more studies showing that people are moving or the providers, including the organization, moving towards a value-based care, right, the VBC. Initially, VBC it was defined as a quality multiplied by outcome of care divided by cost. But I think the latest definition is actually to add in two more, which is user experience and also safety of patients, right? So if we actually able to bring down the cost, the lower the cost, the better the value based on this, the definition. And of course, the better the quality, outcome, user experience, or safety, the better the values. And of course, all this must be measurable. So need to find ways how do we measure quality, right? Pre and post treatment, things like that. How do we measure the outcome of care? How likely patient go back to theater, all this, right? I think all these are already in place, and MOH and all the stakeholders are already doing it. But how can we make it more efficient and more insightful? And this is something that the industry really need to come together and work it out, to really provide value-based care to the patient. And how can we as a healthcare provider value add, our patients, our consumers? And this is very important, and in my opinion. Yeah. Okay. So yep. So this is the next slide. So and how can we actually use the technology to increase support of NCDs? I think Dr. Feisul mentioned about NCD, and it's quite a huge burden to the country, to the family, right, and of course to the patient themselves, right. So you see all the numbers here based on the National Health Morbidity Survey 2019. The numbers are crazy, right? So there's still a long way for us to go, still a lot of things to be done to really tackle these NCDs. And of course, you also have another challenge like the B40 group. How can we actually engage them? It's not easy, right? B40, a lot of times I quote, right, and it's not their priority is always not about health, it's about their basic needs, right? So how can we actually change the mindset to take care of the NCDs, right? And I think that MOH has been working really hard on that with different stakeholders. I think to a lot of things to do, right? And it's not easy. It's a very challenging situation as well. And NCD is another challenging part, not only in Malaysia but worldwide as well, to deal with it. So I think one of our main areas to focus is also always NCD. COVID-19 is seasonal. It will go one day, right? And possibly second pandemic, a big touch wood, maybe it will come in the future. But all these are seasonal. But what is not seasonal is the NCDs, right? The non-communicable disease. How can we continue to improve the detection, the management, the mortality and the morbidity? So these are the things that we need to look into it, and how can we leverage on technology, right, to manage this part of our NCDs, right? And so if you have an increased support for the NCD management, actually, with the growing demand, I think technology can help to improve the convenience, the access, the cost, and of course the quality of the NCD care as well, right, for the chronic patients. And of course, this convenience, not only provided to the patients, but also to the providers. How can we make the providers, practice in a more efficient and effective manner, instead of one time they can see, X number, but can we, at one time they can see X plus Y number of patients in a more efficient, more technological driven and data driven practice. So this is something that the technology can bring in to really help to support our practitioners, right? We need to handhold together to work with them, because it's not easy for healthcare providers, because including myself, healthcare providers were trained in a very, so to speak, a very old school manner. So it's really about knowledge and and clinical, but we are not taught about technology. We're not taught about digital health. Of course, now you're seeing more and more courses actually incorporating some of the digital health or technology or even coding into the course, which is very good, right? But for those who are actually in the system, we need time to really walk through with them. They can be skeptical, they can be anxious and concerned. It's just like how you ride a bicycle, two-wheel bicycle. You are anxious because you do not know. You're afraid of fall, right? But if we actually provide proper guidelines, regulatory framework, all this, right, and the do's and don'ts, I'm sure more and more providers will be more willing to come and adopt and handhold together with all the stakeholders. And I think only then it will work. Otherwise, the providers will be having big time or difficult time to really adopt the digital health, and we do not want the technology to marginalize certain group of people just because they are not savvy, just because they're skeptical, right? So how can we be more digitally inclusive? And again, this is a very huge area, right? Digitally inclusive for all the 4Ps, right? Providers, patients, policymakers, and also the payer, right? And it needs a lot of efforts of all these, 4Ps stakeholders. Yeah, and me alone can't do anything, right? We need everyone to hold hand together to come into that. So the goal is really to normalize the use of digital health services and consultations, just like genetic testing, how common it is today as compared to 30 years ago. And we hope the digital health of tomorrow will be becoming more and more common for the end users and for the providers. And so this will be our goal actually, to normalize the use of it, right? So and the going trends, as I mentioned, the wearables, IoT, expansion of telemedicine in more areas, like different specialties for the new cases, not only for existing cases. How can we actually provide to the new patients using telemedicine? That is another big topic to talk about, but I think it's possible in the future. So in conclusion, these are the key drivers, as I mentioned, today, and the digital health players, the platform players to increase adoption, the end users, and not to forget, we also need the research people, the scientists, right? You have USM, the institution, to come on board, the academia, really to work together to really drive this digital health adoption. And because really leveraging on each other's strength. For instance, academia might not be very strong in commercialization, right? Because if you provide a product, or you develop a product, right, or invent a product, but without marketing or commercialization, that is going to be very difficult for people to adopt, right? So if you work with some of the industry players, and they are maybe very good at marketing, they are maybe very good at commercialization, business model, business planning, right? And if we bring all these resources together, right, and all these cogwheels will start going, and the whole wheels will start moving, right? So this, the key drivers are still the people, the 4Ps, as I always think, right? Yeah. Okay, so I think that will be the last slide, and as I mentioned this earlier, right? Thank you very much. Sorry about the lengthy sharing. Yeah, so that's all from me. Thank you, everyone.
Thank you very much, Raymond. Don't worry, Raymond, it wasn't lengthy at all. So already have several questions. I would like to urge the participants. Raymond is he's hands-on. Of course, he wouldn't be able to share everything, right? This is just a short session. So I would like to urge participants to ask any questions. So to start off with, let me just check. We have already several questions. I think I'll start off with mine first, Raymond. These are often asked questions when it comes to the doing. How would you describe the regulatory environment in Malaysia when it comes to digital health solutions? I'm just going to use that broad term, right? Digital health solutions. And the often asked questions is, about data security, data privacy, who owns the data, right? These are often asked questions, particularly for people who are new in the field in Malaysia. And I think it is a very practical issue that perhaps you could highlight the key features.
Yeah, thank you, Dr. Feisul. I think it's a very good question. You're right, a commonly asked question for all the digital health players and stakeholders. If you look at Malaysia, the current regulations on digital health in specific, right, is actually none, right? And of course, you have different acts actually governing the practice of medicine. You have a medical act, you have Poison Act, and of course, you have the data, the MCMC side, right, to talk about the cyber security. But in terms of digital health, there's no, a regulation to really govern this space And this space, as we speak today, is still a self-regulating space. And the good thing is actually, the Ministry of Health actually is very determined to really, look into this space. And, they consulted the firm last year and, have a regulatory framework recommended. And now we have the Red Lab, right, by Futurize, working with Futurize. So it's like a sandbox for the digital health to really come into that together, all the stakeholders, not only the startups, right, the tech players, but also, like MCMC, MMA, MMC, all these, important, stakeholders to come together to really let us study the model, the system, right, so that we can actually, address issues like what you mentioned, data security, right? MCMC will be part of it, and that, all this, right? So how can we actually improve or make or to minimize the risk of data leakage and all this, right? So I think a lot of issues, right, can be addressed within the sandbox. So hence I would encourage more and more stakeholders here to really join. In fact, they just opened the application this month, right? The Futurize Red Lab, and so please join. And then they're welcoming the first cohort. In Singapore, they already started 2 years ago, right? The LEAP program sandbox for digital health. So yes, we are rather late, and of course the COVID-19, but I think it's never too late, and it always starts from now, right? There's no best timing, right? So I think now is the best timing, and where will it lie in the future? I think no one knows, but at least there's a first step. We come together to really move this space, and so that this space can be regulated. And finally, I think, like it or not, healthcare is a heavily regulated industry, very complex industry. And if digital health is not regulated, the safety might be compromised, because you might be having very creative people coming into this space and doing something creative, right? And without looking at the patient's health and safety, maybe only looking at the top line or the bottom line. So that is not good. That's not ethical, right? So if we are able to come together and to have this space regulated, I think this is what the industry should move towards. But I think MOH also having some challenges. For instance, the technology today that we are having might not be relevant anymore for tomorrow, because technology is growing so fast, advancing every day or even every single hour, right? So I think MOH is also leaving some space, based on my impression, that for the people to innovate within the safe space, right? So that innovation is not killed. Because if you tightly regulating this space, they will kill the innovation. So it's a balance to strike, not too tight, but not too loose either. So hence the function of this sandbox, the regulatory lab, is about, right, to come together to find the balance. Yeah, so I hope I answered your question, Dr. Feisul. Yeah.
Thank you. There are quite a few questions here, which I think you can see on the chat, but let me just try to put it in a more coherent. So we talk about the regulatory framework. Let's now talk about financing. In the context of healthcare financing, right, Malaysia only spends about 4% of its GDP on health, about half on the public sector and half on the private sector. And only from the healthcare finance health accountings report, only about 8% of Malaysians have got health insurance. And I think about 37% of Malaysians pay out of pocket. So this is just for participants as well. I mean, I think context matters when you start comparing between countries, because somebody was asking, so how do we compare Singapore, Indonesia, and then of course if somebody picks up Taiwan or South Korea, for example. So again, I think Raymond, from your perspective as a practitioner, how do you feel the financing in terms of healthcare in Malaysia, and how does it impact either for digital health solutions or against digital health solutions, both innovation and implementation in Malaysia?
Yeah, thank you, Dr. Feisul. Wow, another tough question, financing. If you look at in the world, right? Actually, personally, I think there's no perfect healthcare system in the world. Every system comes with their weaknesses. Of course, their strength. You look at the state, right? Very insurance driven, and and you look at Malaysia, it's totally different. You can't be apple to apple. Even Singapore and Malaysia, right? The systems are different, right? So we cannot compare these two. It's really about how can we improve you know, the current healthcare system on the aspect that I mentioned just now, the value-based care, the cost, the quality, the outcome, all this, right? Experience and safety. And you look at financing, you know, if you think positively, right, actually, even 4% of GDP, but a lot of patients actually benefit a lot from the public sector, right? In terms of getting, you know, adequate, you know, medications and, you know, procedures and all this. And if you want to compare to the other third world country, and we are considered quite good, right? In terms of the expenditure and the mortality, all this. And I think it's a very tough question that I don't think I'm in a very good position or the right person to talk about the financing, because it's a huge topic on financing. But one thing I would like to point out is actually the financing part on the digital health, right? So if you look at, you know, maybe 5-10 years ago, actually, you know, none of the insurers will actually finance the digital health solution, right? And, you know, if you want to claim, you know, you always go back to the brick and mortar, right? Clinic, hospitals, right? You need to be admitted, right? Even for MRI scan, you need to be admitted so that you can claim, right? Of course, I'm not talking about the abusive, all this, right, part of it. But now you see more and more insurers actually going into digital health. They actually recognize, you know, the digital health. They actually, in fact, they pay for digital health services, right? And because they realize this is value added to their customer, to their patients, and looking at the short-term gain and the long-term gain. Short-term gain, maybe there's a cost optimization in the short term. But long term, if you continue able to engage with the healthcare providers, you know, the dietitian, physio, all this, right, the NCD might be improved. They might not even go into the complication of the NCDs, right? Of course, that one we need to really look very far, right, and to project that. And most of the time, you know, payers will look at the short-term gain. So and I think it's very promising that, you know, more and more insurers looking into that, not only in Malaysia but also worldwide, in Hong Kong, in the States, and, you know, they finance the digital health solution, the telemedicine, all this. Yeah.
Thanks for that, Raymond. The reason I wanted to highlight that question, I do apologize, just rewording some of the questions that are being posed, is because oftentimes people look at digital health solutions and forget the context of the healthcare system of that particular country or geographical location where it is being implemented. This is where context matters. I think I know the argument, you know, you're hoping digital health could disrupt, right? It just because it's there, is then suddenly things change around it. But I've not seen healthcare digital solutions being that disruptive as compared to the other sectors. Wouldn't you agree with that, Raymond? Right now it's more like in a more supporting role to see how we can value add to the when then you, I mean, I'm happy with your definition of what is quality, right? It's not just about outcome for us. It is about the experience as well, for the patients and for the users of the system. So now we just move forward from that earlier theme about regulatory framework and then about financing. I mean, what do you think could contribute to the differences in response or uptake of digital health solutions in one country over another? Is it just purely on systems? Is it purely on financing? What do you think? I mean, because I'm sure you have seen the other countries around the region as well.
Yeah, I think there are a lot of factors actually affecting the adoption of digital health solution or digital solution as a whole, right? In different countries, and I just name a few, right? As I mentioned, you know, infrastructure. The infrastructure must be ready, right? When we say infrastructure, not only the cable, the tower, all this, right? But you know, the devices, are we ready? You know, the network, is it stable in all areas? And second would be the people. Are people ready, right? People talk about in healthcare, talk about patients, payer, right? And the providers, are they ready to adopt, right? If compared to other countries, they might be 5 years ahead of us because they already been, you know, educated. The awareness, it was done, you know, maybe 10 years ago, right? So we are we're still in the baby step, actually. We're still in the baby stage at the moment, like, you know, to you know, there's still a long way for us to go. And third, you know, talk about innovations, right? And of course, digital health, you need innovation. It's a country, you know, friendly enough for innovators, right? They're welcoming enough for innovators to innovate. It's a safe space for them to innovate, right? When I say safe space, it's a regulatory framework, you know, or the regulation ready supportive for all the innovators, right? Not only local but also foreign. How can you get more foreign, people to come and innovate in this space, right? And the laws and all this. So all this will play an important role in the adoption. If you look at Singapore, right? If you want to compare, Singapore infrastructure ready, people more or less ready, right? The policy are ready, right? And the ecosystem, including the funding scene, because innovators they need funds, right? The funding landscape is, I must say, is healthier than Malaysia, right? So if you want to innovate, you need funds, right? And it's seeing more and more, for instance, Grab. Why would Grab move to that side? One of the reasons because of the environment and the infrastructure, the tax, right, is lower for tech players, right? So all this will contribute to the adoption. And I just I mentioned a few of them, but that I'm sure there are many. Yeah.
Right. I would say the challenges, as it were, well, from your description just now, Raymond, so it's more challenging to do it in Malaysia than compared to Singapore. And these are, just to highlight again, sectors which is outside of health. You're talking about infra, you're talking about what's that, financing, that's not just necessary from health, right? Can be from the ministries of science, can be from investors. So you mentioned just now about the demand side. I mean, I'm rephrasing. That means we can have a solution, but is the population ready for it? Does the population see value in it? That's the demand side. But you talked about innovation as well. So one of the question is asking about your perspective on the research evidence for these innovations. So what do you think about the focus for investment on funding systematic development and evaluation of digital health solutions?
Yeah, thanks, Dr. Feisul. Yeah, I think it's a very good question. Say you get the funds of 1 million. It's really how you actually utilize your funds. As a commercial body, of course you have other areas that you want to focus on, which is commercialization. How many percent you want to focus on it? But fundamentally, it's really about your services, your product, your solutions, right? It's really not about the marketing shout out alone. I mean, that is important. Fundamentally, it goes back to R&D. Right, so the R&D is really the key to improve the quality and the outcome and the safety and all this. I mentioned the value-based care. It's not your marketing, your commercialization model, but that one is actually for you to sustain your business. But more important is the R&D. How can you continuously to improve the current technology, right? Or or maybe to implement new technology, right? AI and all this, right? Deep learning, all this, right? And all this requires huge funds on R&D side, and hence working with academias, the scientists are actually no-brainer in innovation. So it's really how we actually can get all the resources together in a more cost-effective manner, right? Because R&D is not cheap. R&D is very, very costly. So it really depends on the company or the people that which area they would like to prioritize in the for instance utilizing their funds. Yeah. But R&D to me I think is very crucial. Yeah.
I think just to emphasize an earlier point about working with others. In your presentation, I could recall you saying working with the industry on marketing, right? On selling it as a product. So I would say along the same theme, working with academia or research institutions, as it were, for your R&D. I don't think in this day and age you have to do everything yourself, right? I think
yes, absolutely.
It's about teamwork and to work with others. So just going back just a bit, earlier on, there's a question from Wilun saying that engaging primary care practitioners will be a practical step in providing value-based care, in his opinion. However, there seems to be a lack of adoption among PMPs. I mean, is that what you feel in your experience, Raymond? That lack of adoption, and if yes, what are the challenges? Or if otherwise, what are your thoughts about the engagement of primary care practitioners. At least in our context, and I think perhaps we just differentiate between public and private for so that we can talk about more in context in Malaysia.
So in terms of context, Malaysia actually from private primary care side, right? I think there is a lack of adoption in digital health. That is proven. There are a lot of reasons behind, and one is actually, you know, that they might not see the need and the value because the practice itself actually is functional, is ongoing. Patients are not demanding more, right? And they go to see cough and cold, you know, or get your medication refilled. You know, patients are used to it, so they don't see the need to change, right? And they don't see the need, you know, the pain at all, right? Of course, they a lot of them started, you know, adopting the, you know, the EMR, you know, the clinic information system already, right? Some of the cloud-based, some of the on-premise based, right? But that actually is not good enough, right? So technology is about how can you provide a more coordinated, right, synchronized healthcare, you know, a journey for the patients, and that requires a lot of different parts of technologies, not only the CIS alone, right? And how can you actually plug to even the national record? I mean, you know, national have the, you know, ambition to come up with a national health record, right? So of course there is also another big topic, right? And how can, you know, private side, you know, plug into public side, you know, using technology? Yeah. So I think one of the crucial part is actually the awareness of digital health. Like I say, that the cycling mentality. If you throw a kid, you know, 3-year-old kid a two-wheel bicycle, they won't cycle because they are afraid to cycle, right? Now you throw them the digital health. Hey, can you come and practice virtually? They won't, because this is not they've been practicing, right? They've been practicing, you know, must see the patient, must check the throat, you know, must feel the tummy. So, but if we actually provide them the proper guidelines, practice guidelines, with the regulatory framework, all this, right, to show them, okay, this is actually safe and this is regulated, this is you can do, this is you can't do, then I think they'll be more than willing to come on board, right? So this is also one of the readiness that actually I was talking about, that actually, you know, hinder them from adopting as well. They are very skeptical about digital health. Yeah.
I think the reluctance to change is not just among patients, right? When you ask them to change their behavior, they're very reluctant, even if it's for their benefit.
Yep.
I think healthcare providers as well. And I mean, I fully agree with you, because the adoption of AMR and, you know, clinical information system, it's not so much for the benefit of the patients, right? It's
Yep.
for you, because you want your work to be more efficient, for you to easier to retrieve
Yep.
your records, to do your, you know, your reimbursement, everything becomes more efficient for you.
Yep.
But the interaction, you don't see that very much to your benefit to adopt the other.
Yep.
But wouldn't you say the younger ones would be more receptive? I mean, the younger doctors be more receptive, or is that a wrong assumption on my part?
It's not wrong assumption. Actually, the younger ones are relatively, they're actually more receptive. And in fact, on our platform, majority are young doctors, about, you know, 5 years or less than 10 years of practice. And of course, I have retired, you know, GP as well, who actually, you know, willingly to practice. Yeah, so the young ones actually are easier, especially those hungrier, you know, doctors who actually just started the GP practice. And so they need to increase the avenue, not only, you know, the corporate, the private cash patient to fall on the doorstep, but how can they be more visible in the virtual world, right? To get to see more patients, and so that they can drive online patient to the offline page, to the offline as well. So we were seeing more those hungry doctors who actually would adopt better. Yeah.
Can I just go back to your earlier statement about more insurance companies in Malaysia reimbursing, or at least acknowledging digital health services? That's another follow-up, maybe a more detailed question. Having existing payers, insurance, TPA reimburse telehealth visits may be a major step in normalizing telemedicine. Are we anywhere close? I mean, what do you see as development? I just like to highlight for the participants, you know, only about 8% of Malaysians have health insurance, which is very low compared to countries of similar economic level. A huge proportion are still paying out of pocket, and I suspect with COVID-19, actually that proportion in the year 2020 and the year 2021 could have gone up quite a bit in terms of health accounts. But anyway, going back to the question, Raymond, what are your thoughts about the development of payers, at least in Malaysia, in financing the adoption of digital health?
Yeah. Thanks for the question. I think you're right. You know, the penetration of insurance in Malaysia is really low, 8%, right? And however, if you look at insurance company, they're not only insuring private, right? They're also insuring, you know, corporate, right? So if you look at the corporate world, and the working adults is about 16 million, if I remember correctly, adults, right? Working adults in Malaysia, right? So and a lot of them actually are insured by the company, right? Of course, the company actually got the insurance, right? And so in a way that indirectly these employees are insured, not out of their pocket, but it's part of their medical benefits. So as such, we're seeing the trend that insurance company are adopting, you know, or partnering with a digital health or telemedicine player in providing this solution to the insured employees and their dependents, right? So, and this is a paid by the insurance as covered. So this is a very good, you know, a step that, you know, to show that actually insurance company actually are acknowledging and recognizing digital health solution. Of course, this is not massively, you know, roll out to all their, you know, retail clients of insurance, right? But I think they are moving towards that to the private patients, not only the corporate. They're moving towards that, but that one will need a very big jump. So because the industry is very heavily regulated, including the insurance, so they have been doing the corporate, but the private part actually, you know, they still need some time. But I think in the future we definitely see more and more, you know, insurance company able to insure telemedicine and recognizing telemedicine as a service, as a paid insured service. Yeah.
Just a follow-up question from me, Raymond. How do you see compared to the other countries in our region in terms of reimbursement by insurance and third parties?
Yeah. So if you look at Singapore and Thailand, right, they are already practicing this, you know, the insurance company, the big ones are already, you know, providing, you know, telemedicine services to their clients, right, as well as to the private patients. And so we're definitely looking into these two countries, including, I think, Vietnam, if I'm not mistaken, are moving towards that. Indonesia is actually doing that as well, right? Insurance company, you know, focusing on corporate, providing telemedicine. One of the reasons why, you know, you might think, you know, why would, you know, insurance companies so, you know, because they're the most risk averse company, right, in the world, right? So why would they actually adopt digital health while, you know, a lot of their panel doctors will actually argue, hey, this is not safe. And of course, one of the reasons they see the values, and second is actually the cost optimization that can bring down the costs quite significantly. On average, we're looking at in the region. So they're seeing maybe 20 to 40% of saving in medical expenditure for the corporates. So that's quite substantial for the big companies, right? And outcomes the same, quality hopefully better, but cost lower. So that's value-based care, right? So that's what insurers are seeing. Hence, of course, there's still a lot of areas that we can improve. But I think we can actually look at, you know, China, Singapore, you know, all this. This is where we will be heading towards in the next few years' time. Yeah.
Thank you. So I'm just gonna again go back a step, drawing on your experience, Raymond, as a practitioner. So you have the advantage of being a medical doctor, working in this digital health space, whereas I'm sure you know there are many innovators working in the health space who are non-medically trained, you know, not the traditional sense. So what, and of course we have talked about earlier as working as a team. So perhaps there are individuals, participants out there who are both either medical doctors, healthcare professionals, or even non-healthcare professionals wishing to go down the same journey as you have, Raymond. So if you can go back and tell yourself in what year was it? 2015, was it, when you started this?
Yep.
What would the tips be that you will go back and tell yourself in 2015? How would you could have done it better in terms of well, doing the business as it were?
Yeah, probably I'll go into cryptocurrency back then.
Fair enough.
Joke aside. Yeah, I mean, if you ask me, I would have done the same thing. Actually, it's quite interesting. It's a very challenging environment if you compare to, you know, if you go to other sectors, probably, you know, less strains and regulations governing you, right? But when it comes to healthcare, it's a different ball game. And it's very, very challenging, especially when you want to innovate, right, and change the status quo, right? You hit a lot of roadblocks, and really it's about, you know, what's your end goal and how can you actually improve and work with people. You need to work with people, right? It cannot be silo, right? Silo is, it will bring you nowhere. But working with strategic people and maximize the value is the key to going towards the same goal, right? Like-minded people, of course, right? Our stakeholders. And to answer the question, you know, be a medical practitioner or non-medical practitioner, to me, I think personally, if you want to come into this space, innovating, I think it doesn't really matter, right? Whether you are a medical practitioner or you are the technologist, right? What matters is actually what's your purpose. Are you creating solution for the sake of creating it, or are you actually seeing the pain point that you're trying to solve, right? It's really back to the purpose. What's your purpose of doing this, right? It can be a medical doctor innovating this, but a very wrong purpose. That also can go very bad, right? So likewise, you know, the technologies can be, you know, maybe it's a personal experience of a family, and then he thought, you know, I can use my skill set to actually, you know, improve this space. It can be just a hospital waiting time, right? If I have something innovative, right, then, you know, then why not, right? So to me, it doesn't matter what profession you are, as long as it's your heart that matters, to me. Yeah.
Right. Thank you. There's still quite a bit of questions, and we are reaching time. I'm very cognizant of the fact, and actually, some of the questions seems to be addressed to me, Raymond. Not
Okay,
so
you
much.
can answer.
You know, what I mean, it's more policy in terms of, you know, can NCD management be done with digital health solutions? The answer is yes. I would just like to reiterate some of the points that have been raised. Is our digital infrastructure ready? The answer is not. There are still locations in urban areas where digital penetration is poor. I've mentioned briefly about demand. I think we often forget, just because we can develop a solution which is great, you know, I use the term, you know, can bring you to the moon and back, doesn't mean that people want to go to the moon and back. So we need to understand what our clients are, the people living with NCDs want. Now we're talking about people living with NCDs where health literacy, correct, digital literacy plays an important role. And we need to, you know, see our population differently. What I mean is, you know, male and female, socioeconomic group, level of education, which is a proxy for level of health literacy, where do they live, what do they work, their family circumstances. This is matter because our population is not the same. And there are some who are more vulnerable than others when it comes to NCDs, and some are more readily engaged with digital health solutions compared to others based on the infrastructure, based on their mobile phone, based on why they use their mobile phones, based on, you know, and their attitude towards health. So there are many factors in play, and this is what those people working in digital health solutions need to take into consideration as well. And hence, for example, just to bring us back to the stroke study that we are looking at, that's why we are trying to see whether we can actually implement it in a low resource setting, because that's our target population. If you are high income, you could find your solutions already now. You know, you would call people up, you would look at resources which is available on the internet. You know, it's, I'm sure, right, Raymond, if you think of a disease, I'm sure there is an app for it already.
Yeah,
Whatever condition.
yeah.
You know, you won't be the first person, I can tell you that much.
Yeah.
But can we run it in our context? I think that's one of the key questions that we need to ask. Right now, all chronic diseases, you know, if I'm a diabetes patient, there's plenty of apps, free apps available out there, and I can't think why MOH should create one, for example. when there are excellent those which have been evaluated. So I think we need to think of all the other regulatory environment and structure and patients acceptance before we can talk a bit more whether adoption. Internet speed, affordability, obviously, right, Raymond? That does influence. Our internet is not the cheapest in the region.
Nope.
And quality aside, let's not go there. Even in Putrajaya, sometimes I show the line is bad, and talking about Putrajaya, okay, the administrative capital of Malaysia. All right. Okay. Perhaps a bit more practical question about AI and large databases. Raymond, any tips on how you handle large number of database, prevent loss of data, and incorporation of AI into the work that you do? Perhaps you can just comment specific on doctors.
Yeah, thank you very much. I think in short, AI is the future, but AI needs oxygen, right? The oxygen is the data. So I think we are still in the stage of collecting, structured data, good data, because most of the time the data collected is not structured or rather raw and might not be meaningful, right? So we're still in the stage where we are collecting all the data, make it more structured, and so that we can in the future, apply, deep learning, AI, so that it will help to improve the predictions, for instance, right? And all this, but AI definitely is here to stay and to really complement the doctor's practice, the healthcare providers, the policy makers' decision part as well in the future. But we are not there yet in Malaysia, for instance. But there's still a long way to go. And in terms of data security, all these, no matter how secure your system is, right? The hacker is always in front of you. Right, we are always being reactive, right? No matter how advanced you are, because people will be more innovative and creative in hacking you, right? But it's really about your environment, your infrastructure, right? And your server, right? Do they have, like, for instance, HIPAA compliance, and do they have all the security measures and compliances, all this, right? And that matters because it will help to mitigate all the risks should it happen, right? So there's no I don't think anyone can safely tell you that my system is 100% safe. No one. Even Singapore government, they also got hacked, right? The national health record, all this, right? So there's none. It's really about when you react, right? How do you react, and how the system actually reacts to it? I think that is more important. We can't proactively go look for hackers in Indonesia. There are a lot in Indonesia. But yeah, so I think it also has a collective effort with the stakeholders, including MCMC, working together to safeguard this space, because health record is one of the most sensitive data, like it or not. Yeah. So that's my point of view. Yeah.
Great. I'm just going to take one last question because I think this is talking about inequity. I'm going to respond first, Raymond, and perhaps you can add on. The question from Sokwan Ng is, with the difference between urban and rural areas like digital literacy and infrastructure, would having telemedicine cause even more disparity between rural and urban population in terms of health access? I would just like to add a bit on. I think people sometimes think about too much about the urban and rural divide. Let us not forget that almost 80% of Malaysians live in urban areas, and the urban poor is a real issue. And even in urban areas, digital literacy and infrastructure is problematic. That's the reality, right? So it doesn't have to be rural. I think that's my point. So my response to this is where the thought that comes when we develop the digital health interventions is very important. Are we designing it for which population? Is it for the vulnerable groups, the lower socioeconomic group, or are we designing it for the high literacy, highly educated group? Because if it's just targeting the higher group unintentionally sometimes, yes, that's what you risk doing. You're making the disparity between those with the haves and the have not just become larger. So the problem is not with the digital health tool, right? Because it's just a tool, but how we develop the tool and how we actually implement the tool that matters. So just a simple example, a lot of digital health solutions in India, in the low resource settings, just uses SMS technology. Digital health doesn't mean complicated things. Let's not forget, and they have evaluated, it works really well for the intended purpose, both for empowering patients and empowering their health workers who work in the community. It's just SMS. So that's nothing complicated. And when we develop and we implement our digital health solution, I think the focus should be on the vulnerable groups if we want to reduce the gap between inequity. I'll stop. Anything to add, Raymond, for that question about
just a quick one. I think, just a quick one. Fully agree with Dr. Feisul's point of view, and my take is actually no one size fits all, right? Because the solution itself, it can't fit everyone. It can't fit everyone because we have P40, M40, and then T20, and urban and suburban, all this, right? It really depends on who's your target audience, right? And who do you want to help with the solution? Of course, unintentionally, you might actually divide, certain group people or marginalize certain group people, but there are always other solutions to help, different group of people. So that's why we need more innovators to come and, be more specific to help, it can be diabetes at, early stage, right? Younger people. And for instance, low tech is also a tech, right? So I think I remember, Digital Health Malaysia DHM, I think 1 or 2 years ago, we also did some study on using SMS for diabetic patient, and the result actually quite encouraging. And probably we need to do more on that because not everyone has a data connectivity, all this. Some people are still living with the SMS, right? And if you can reach out to them through SMS, why not? If your aim is actually to educate them, empower them, right, remind them, then SMS also works. It's a tool, it's a communication tool anyway, right? So it really depends on what you want to provide and who you want to provide to. Yeah, that's from me.
All right, great. Thank you very much, Raymond, for your time, for your sharing. It's always great when we have a practitioner willing to share more hands-on experience, because oftentimes sometimes we hear more of the theory side, right, of digital health. While that's fine, I think more questions usually come when it comes to implementation. So again, thank you very much, Raymond. I forgot actually to thank our host here, USM, for hosting this event. So before I end, can I just ask Prof. Kim or Tuan Siti, any last words from the host? I do apologize. I forgot to acknowledge the host at the start. So Kim, anything? I'm just putting you on the spot.
Sorry.
Yes, Kim, we can hear you.
I was not expecting to say anything. So it's all good. So back to you, Dr. Feisul.
All right. So all good from USM. So thank you very much to the participants. And with that, we shall end today's session. So thank you everyone for joining, and thank you everyone for a lot of questions that we had. Okay, thanks
Thank you, everyone. Thank you.
Okay,
Thank you,
bye everyone.